Well, good afternoon. Over the past few weeks, we've seen a sharp increase in the spread of COVID-19. Today's numbers, they're deeply concerning. And our health officials are telling us that Ontario is now in the second wave of COVID-19. We know that this wave will be more complicated, more complex. It'll be worse than the first wave we faced earlier this year. And we've all played a critical role to play. Please follow the health guidance. Please download the COVID Alert app. Please get your flu shot this year. It's absolutely critical. If we can get everyone to take these simple steps, we can tip the scale. We can avoid the worst because we know that we're in the second wave. And we know that it will be worse than the first wave. But what we don't know yet is how bad the second wave will be. The reality is, it's up to each of us. Together, our collective actions will decide if we face a wave or a tsunami. My friends, this is extremely, extremely serious. Everything is on the table. We've already taken countless steps to restrict gatherings, to address the hotspots. We've been working around the clock. We've been preparing all summer for exactly this situation. And that means strengthening our healthcare system. It means adding more resources, adding more testing capacity, and most importantly, adding more boots on the ground. As we enter the second wave, getting more healthcare workers, more nurses, more personal support workers. Getting these folks in place will be absolutely critical because our frontline heroes, they need reinforcements. That's why today we can share the details of our plan to recruit, retain, and support over 3,700 more healthcare workers and caregivers. We're getting thousands of healthcare workers ready, thousands of healthcare workers, nurses, PSWs that we can quickly deploy where they're needed most. In total, this plan will mean over $52 million to hire and train thousands of new healthcare workers. We're adding 800 more nurses. We're adding 600 more acute care nurses in hospitals and for long-term care homes, 2,000 more personal support workers. And we're giving recruits a $5,000 incentive to make a 6-month commitment to work in long-term care and other settings with urgent needs. And that's going to be absolutely critical over the coming months. And we're investing another $14 million in the Personal Support Worker Training Fund to continue training more PSWs for long-term care home and community care. And I'll have more to say in the coming days on providing additional support for our great PSWs. But my friends, I'm sending out a call today. We need more healthcare professionals.
And our continuous fight against COVID-19 is critical. I would say especially weeks where we've seen a significant increase in the number of confirmed cases. That's why we're taking further action to ensure our frontline healthcare workers are supported and that the healthcare sector has the staff to provide timely, high-quality care. Our investment of over $52 million to recruit, retain, and support frontline healthcare workers will ensure our healthcare system can meet a potential surge in demand while continuing to provide safe and high-quality care. As part of this investment, we are providing an additional $26.3 million to support personal support workers and supportive care workers, and $26 million to support nurses. This funding will go towards recruitment, training, and placements in areas of need such as long-term care homes, home and community care, and acute care settings. We will also expand training tools and resources available to frontline workers across the social services sector, and continuing updating visitor policies for congregate care settings, including long-term care, that promote family and caregiver involvement to support better care and reduce isolation. Recruiting and retaining our frontline healthcare workers in our continuous fight against COVID-19 is critical. That's why back in April, our government launched the Health Workforce Matching Portal to help reinforce the front lines of our healthcare system. Through that portal, we've made over 1,100 matches for over 1,000 healthcare employers across the program to date. We're going to build on this success by investing $200,000 to improve the Ontario matching portal and help more employers get faster matches that best meet their needs. Today's significant investment will allow us to recruit, retain, and quickly deploy our essential healthcare workers to where they are needed most, and ensure that our healthcare system is prepared to deal with any outbreaks or surges in cases. Thank you.
We'll go to the phone line for questions. First question, please.
Your first question comes from Ashley Legasic with News Talk 1010. Please go ahead.
How you doing, Ashley?
Hi there. Thank you for taking my question. Premier, you said the second wave will be worse. By what measure are we speaking about? Deaths, hospital capacity, the economy? What does worse mean? What does worse look like?
I'll pass it over to Dr. Williams. Thank you.
So, Ashley, thank you for the question. And when we're looking at all the data points with our command table, as well as with our various subgroups working at how the situation in Ontario is evolving, we've been through this before with our first wave. We have many more metrics in place. We're watching our hospital utilization, ICU cases, those in the long-term care facilities, outbreak, case contact management. So a number of outbreaks are moved on even quicker. We're looking at our lab testing capacity, percent positivity. So there's many factors that play in here, looking at how this is rolling out in the province of Ontario, how it's rolling out locally, regionally, as well as province-wide. So all those factors indicate to us, one is that we are, as the Premier said, in a second wave. The question is, which type of second wave is it? And we've taken the advice and direction of the modelers, have looked at it, as well as what we've seen in other countries. And right now we were in a second wave that looks like one of those undulating waves. How big it is, we don't know yet. It's not like the tsunami type second wave. We're watching to see this will have impact on our systems. How much will it have impact on our systems? We're better prepared this time than we were in the first wave. We have more things available, more documents, and more metrics being measured in all sectors. And so we see those things nudging, and we want to move ahead of the curve, as the Premier said, to step up, to stop this, to flatten this curve as we did successfully on the first curve. And I think we can do that again if we focus on our tasks at hand.
Follow up?
Thank you. And Dr. Williams, I'll ask you another question, and perhaps Minister Elliott, if you could speak to this as well. Is there any conversations being had about whether or not the virus is mutating? We're seeing case numbers similar to the beginning of the pandemic. At this point, we haven't seen huge spikes in deaths or hospitalizations. Do we know if the virus has mutated or changed or weakened at all?
Well, that's another good question. I keep asking our experts, especially the molecular biologists and the lab tech people. There are mutations taking place, but is it having significant effect on the virus? The so-called attenuation of the virus. Haven't seen definitive evidence of that yet. We keep asking and looking for that. As you've noted so far, even with our larger number of cases, keeping in mind, we're doing a lot more testing than we did in the first wave. And so we're testing a lot more younger people in that age group of basically 19 to 39 and to 49. So we're doing that. The first wave, it affected a lot more of our elderly and senior population in that matter. And so we haven't seen yet, as always, these large numbers. The hospitalizations follow about a week to 2 weeks later. And so we've heard our hospital people saying we've got to look at and be prepared. We haven't seen it yet. Doesn't mean we're going to say, let's just coast. Let's think about that. Let's watch it carefully. So there, we're asking those questions. We're trying to see if on a global basis, will it tend to modify and attenuate over time? I'd like to hope that could occur, but as of yet, we have no definitive answer on that.
Next question.
Your next question comes from Randy Rath at CHCH TV. Please go ahead.
How you doing, Randy?
Hi, everyone. To get back to Ashley's first question, I didn't really hear an answer from Dr. Williams. Mr. Ford says that we know that the second wave is going to be worse than the first wave. Could you tell me in what way it will be worse?
Sure. Dr. Williams?
So I think the potential is that it can be worse. Right now, we're on the upward slope of the second wave. I think the Premier, what he's alluding to is the fact that, so do we know it's the so-called undulating waves that we've seen in some of the modules? How big those are, we have to see. We always see it better after we have some time to look at the test results. If it is that more tsunami type wave, it will be far worse than the first wave, as we've seen in other countries. How big this wave is going to be, because already we've seen some test results that are equivalent to what our maximum daily amounts were in the first wave. But as I said before, in that time, the maximum tests we're doing a day around that highest peak was around about 10,000 tests. We're doing 41 to 43,000 at the moment. So it's a different curve, different epidemic. So right now, we're anticipating if it keeps going, we have to assume it could be a lot worse than the first wave, especially if it's the second scenario, that's the more of the tsunami one. But so far, it doesn't seem to be going that way. We like to hope that we can keep on top of this and hear recommendations from myself and others, medical officers around the province, to ask the public to really focus down now. We really have to hunker down and stay at the task to see if we can flatten this curve like we did the first time. People have gotten very casual, I think, at the end of summer, early fall, and we've seen that effect. But I think by everybody refocusing, and we have some ideas and suggestions of that, we can turn this one around. So hopefully, as not the Premier's fears, we might be able to flatten it down, and it may not be worse, but we cannot be presumptive on that basis.
Follow up.
Okay, today the Ontario Hospital Association is calling on the province moving Toronto and its regions and Ottawa back to stage 2 because they're afraid they're going to be overwhelmed if the spread continues. Is that something that should be done?
Well, I had a conversation with Anthony Dale this morning. I understand that's what they're requesting. And if you don't mind, Randy, I'll pass it over to the Minister of Health to answer that. I always, I respect what they're saying. I also respect their health table. So I always like taking advice from everyone.
Well, we can certainly understand the hospital concerns as expressed by the Ontario Hospital Association because of the increase in numbers. But of course, we are taking advice from the Dr. Williams and our public health measures table. We don't want to turn back a stage unless we absolutely have to. But if we do have to, we will, because the most important thing is the health and well-being of the people of Ontario. So we're watching this very closely, as I know Dr. Williams and his team are, and we are taking, we've taken many steps already with putting the 28-day moratorium on introducing new businesses into the mix in our society. We've also cut back on some of the hours in bars and restaurants and closed the strip clubs. So we're continuing to do our work, but if we have to tighten up even more, we will take Dr. Williams' advice, and because it's absolutely necessary to protect the health and safety of everyone in Ontario.
Next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Hi, Antonella.
Hi, Premier. How are you?
Good.
I wanted to ask what you think might be done about the situation on the weekend, the Wasaga Beach car show, where many people show up on an almost informal basis. They ignore the social limits and they really stretch police resources.
Yeah, that's a good question, Antonella. I had a good conversation with Mayor Bifulci. She's doing a great job up in Wasaga Beach, by the way. But, you know, some of the stories I heard from the mayor that people were prepared to pay the $2,000 and just totally ignore the situation we're in. You know, I really wish, I know it's not realistic, but I really wish I could get a hold of their grandparents or their parents or a family member. And if they go home and tell them how proud they are that they broke the regulations and the guidelines, and by the way, we're going to put your life in jeopardy possibly. You know, I just couldn't believe what I was seeing. It's just reckless behavior, and shouldn't be tolerated by any of us. So it's so disappointing. You know, I've said everything I said last time about their car rally, and they're just sticking their nose up. If they think they're doing it to me, they're doing it to the 14.5 million people in Ontario. You know, you're just hurting your own family member. Who wants to hurt their own family? Who wants to hurt their grandparents? You know, maybe these guys do. And it's not just young kids. It's people under the age of 40 for the most part. They're grown adults doing this. So we're going to be on to them. We have the largest fines in the country, and I hope every one of them get a $10,000 fine. I really do.
Follow-up?
Thank you. In protecting people's privacy in terms of COVID-19 information, there's not a lot of information that comes out to the public about how individuals became infected. And I'm wondering if in protecting that privacy, you might be withholding information from people who need it to make sort of informed decisions about what they do, where they go.
Antoinette, I've had one rule down here, and I've said it from the beginning. Anything you tell me, you better be prepared to tell the public. So that's the rule now. Areas, the breakdown areas of the people contacted in bars or nightclubs or strip joint or wherever they're going. We usually pretty transparent all the time on that, but I'm going to pass it over to the Minister of Health, and she can answer that. Thank you.
Well, we also have the COVID app as well, that if you download the app, you can find out if the person who potentially comes down with COVID advises the network that they have COVID, that you can then be notified anonymously without identifying the person who reported it. This is all completely sanctioned by the Information and Privacy Commissioner of Ontario. We work very closely with them in order to do that. We want to safeguard people's safety and privacy. But as the Premier has said, if there's information that comes before us that is important with respect to COVID-19, that is information we will share, not personal information about someone's identity, but everything that we know about COVID-19, we want the people of Ontario to know as well.
Next question.
Your next question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hey, Robert.
Hi, Premier. I have a healthcare question that's not actually related to COVID-19, so maybe you'll welcome it. But it's an investigation that's on the front page of the Star this morning, showing that Ontario is an outlier in the whole of North America when it comes to the use of nerve blocks, the shots that doctors give for pain. One doctor has billed, he's given a single patient like almost 2,000 nerve blocks, and he's billed something like $8.4 million to OHIP since 2014. So I'm just wondering, why has the province allowed this to happen, and are you going to do anything to stop it? Because it seems like it may not be medically useful, but it's certainly costing the Treasury a lot of money.
Yeah, you know, I heard that was a great story, by the way, Robert, and it really brought light on what's going on in some cases. But I'm going to hand it over to the Minister of Health. But that was shocking when I read that story.
Well, this is a situation that we are aware of in the ministry, and we have been working with the Ontario Medical Association and their appropriateness working group to find situations where perhaps there have been practices that are maybe not what's currently the best practices, or where there are perhaps overuse of some parts of the system. This is one group that has been identified, but we're still working with the Ontario Medical Association on this to determine what's truly going on. I know that there are some situations where there have been an excessive use of the number of nerve blocks, and that is something that we're absolutely going to follow up on, because we want to make sure that every cent that goes into healthcare is going to be used for the proper purposes and for the people that really need that help. But that is a discussion, certainly with respect to the use of nerve blocks, that is ongoing with the Medical Association.
Next question.
And back to the Premier. I mean, the Premier earlier, just back to COVID, earlier in the pandemic, You obviously were watching the numbers very closely. Dr. Williams was, Minister Elliott was, and you had certain thresholds for moving to stage 2.
Yep.
Are we still, stage 1, stage 2, and so on? Are we now, as we are in stage 3, is it time to be looking and telling the public what are the thresholds for heading back to stage 2? We have the Hospital Association calling for it, the Liberal Party, Stephen Del Duca is calling for it. What's the threshold to do it in the GTA and in Ottawa, and places that are definitely higher than the rest of the province?
Yeah, if you don't mind, I'm going to hand this to Dr. Williams there. Thank you.
So the staging coming down in phase 2 with the stage 1, 2, and 3 was based on the data and how we're doing with the testing at that time and our positivity. So we're watching this one now with our public health measures table to see how is it impacting. And unlike the first wave where it was in every part of the province, every health unit had cases, we see a variation. And while they had one case for now and again, some have really very few cases. Most of our cases, even of the 700 we see today, are concentrated in the 4 to 5 major dense urban areas. While the rest are doing fairly well, they're not without some problems. They have a few cases and they've been resolving those. So it's going to be different metrics as we look at it. And as we look at areas that we might want to deal with in consultation with the local medical officer of health, who has that region or area, we're trying to be, the term we're using is more surgical. Is there certain things that we see because we have better data on types of outbreaks, places of outbreaks, and where we might want to put in, as we have already with the Premier and with Minister Elliott and the Cabinet, some restrictions across the province, but some local medical officers of health are taking more selective action in risk areas that they see are particular for their jurisdiction. So it's not so much the same as the phasing going down. We're looking at different metrics, different ways of reviewing it because it's presenting itself differently and it's presenting itself differently in different parts of the province. So we're going to continue to go back to our public health measures table, match with our data and information to give the best targeted advice we can to deal with the steps that the Premier is looking for and the Minister is looking for to flatten this current curve and bring it down. So we'll be informing you accordingly.
Next question.
Your next question comes from Dave Woodard with Global News Radio 640 Toronto. Please.
Thank you. Good afternoon, Premier.
Hi.
Toronto City Councillor Stephen Haldane is going to be asking at Council this week about whether all city-owned phones ought to be preloaded with the Covert Alert app to help increase the number of people using it. What's your take on that?
Well, I have a great deal of respect for Stephen Haldane as I did with his father, Doug Haldane. They're both great representatives in Etobicoke, and I encourage them to put that motion forward. And I think it should be automatic. All city councillors and all other staff that have government phones, they should download it. And that's a message for all of Ontario government workers. You have a phone. I hope you're downloading the COVID app. You know, I got mine right here in my pocket. So, you know, everyone should be doing it. It's just one step of many steps. And that right goes back to our fall preparedness plan when, you know, over the last few days, you've seen us roll it out. If it's hundreds of millions of dollars to help the backlog surgeries, if it's $1 billion on testing and tracing, or if it's the largest flu campaign campaign that Canada has ever seen. We're recruiting an army of healthcare workers today of 3,700 healthcare workers, and this is all part of the great plan that the Minister of Health and the health team has been working on for months around the clock. So it's never one area; it's multiple areas, and that's what we. But the thing that's going to help us most, yes, all those are, but really it's the people. The people follow the guidelines. It's a shame. You know, a few folks, a vast majority of everyone's just doing a great job, but a few folks can spread this like wildfire. So we just ask everyone to please follow the guidelines and with the guidelines set out by the Chief Medical Officer. We have some great announcements tomorrow too for the PSWs, which are doing an incredible job.
Follow up.
Now back to the app. The Canadian Civil Liberties Association wrote a letter to the Toronto City Manager saying that they don't like the idea of mandating it, that it goes against the voluntary nature of the app. Former Privacy Commissioner Ann Kavokian, she told me that she wouldn't approve of the app being mandated either. Now, she was very complimentary of the app initially. Does the fact that it would be mandatory go against the spirit of the app?
You know, I out of anyone, I believe in democracy, freedom of choice and everything. But guess what? It's not your phone. The taxpayers are paying that for that phone. You don't want to put it on your personal phone. That's your choice. I wouldn't force anyone to put it on their personal phone, but you have government property at any given time. You know, the computers are property of the government, of the taxpayers, I should say, not the government, of the taxpayers. Your cell phone is property of the taxpayers. It's not your cell phone. Very simple. And the taxpayers own that cell phone, and I'm sure majority of the taxpayers would like you to put the COVID app on. So if you could, please put it on. Simple as that. It's not going to hurt anyone. It's going to help everyone.
Okay, thank you, everyone.
Thank you, everyone. Thank you. Stay safe.